Okay, I'm going to start because I have here some, I don't know how to say, some problems. I'm going to start. Let's go. And if you have something, let me know, please. Okay, Esther?
Okay.
Okay, thank you. I'm sharing my screen. Can you see now my slide, how to be a physiotherapist specialized in scoliosis treatment?
Yes, now you're sharing the screen, yeah.
Okay.
Now I can see. Yeah.
You can or you cannot?
I can.
Perfect. Thank you very much. Thank you very much. Okay, let's go. Jambo. Now, today we are going to speak a little bit about how to be a physiotherapist specialized in scoliosis treatment. Perfect. Sometimes, as a physiotherapist, we have a lot of doubts when we are speaking about the scoliosis. We don't know where to go. And to be honest, it's really difficult. Yes. Before, Hagit Berdinsky has presented a very nice presentation about 7 major schools about the physiotherapy scoliosis specific exercises. And sometimes we don't know what to do. This was my situation. I remember very well that my feeling sometimes when I started was like I'm living in a dark room and I needed light. And sometimes you say, this light is coming from where? But to be honest, for me, the light came the first time coming from the SOSOR, coming from the International Society on Scoliosis, Orthopedic and Rehabilitation Treatment. This was really amazing experience because after it, I had the feeling that the world has opened for me. And the second one was the Dr. Manuel Rigo presenting me and inviting me to be member of the BSPTS, Barcelona Scoliosis Physical Therapy School. It was really nice for me because after me, the SOSOR, the people, the other physiotherapists, doctors, psychologists, and professionals, technical orthopedics that all of us meet in SOSOR, sharing all the knowledge and sharing also the same doubts that all of us has was really impressive. BSPTS is the acronym of Barcelona Scoliosis Physical Therapy School. This school was founded by Dr. Manuel Rigo. And now we are going to speak a little bit about the prehistory and history, the BSPTS prehistory and history. Here, before in the Hagit Berdinsky presentation, she presented and she spoke about the Schroth, Catherine Schroth, Crystal Lerner Schroth. BSPTS-Concept came from Catherine Schroth and Crystal Lerner Schroth. They started working with Elena Salva in Spain from 1968 to 1989. After it, Dr. Rigo with his wife, they started developing and sharing the knowledge about the Schroth method with Joaquin Kratz and also with the 3 important physiotherapists in Spain, Mónica Villagrasa, Sonia Martinez, and also Nuria Puigdebal. They started creating a very important group to start with the first educational process for the physiotherapist. Also with them were working Marta Serrat and Karin Tillekens. This period was from 1989 to 2008. After it started the first BSPTS period. In this BSPTS period, one specific team coming from America, coming from USA, Amy Sbilivi, Beth Jansen, Cindy Marty, and Patty Orderding, they start developing the BSPTS concept there, and it was a really important moment for our school. And also in Israel with Lior Neuhaus, Liat Sabat, Dror Levy, and Iris Drath. And also from Serbia, Dr. Amina Jelasit, she has been a very important person for Dr. Rigo to develop the BSPTS concept by Rigo. And after this, at this moment, around the world, the team that we have is all of these people that you can see. Some of them from USA, others from Canada. Is the example from, for example, from Andrea Level, Mateusz Korsignoga from Poland, Nikos Karavidas from Greece, and also from Taiwan, Qinjian Chen, Xumin Ding. And I hope that soon has also some physiotherapists from Kenya. Okay, perfect. If we go one moment to Google and if we write there this BSPTS, we are going to see that we have a lot of options, but the first one is the BSPTS.net. You can see here our website, the Scoliosis World Association courses, e-learning about Manuel Rigo, the BSPTS concept. This is the web that you are going to see. If you check it, the BSPTS concept by Rigo. And maybe your question is, what is our aim? What is the Barcelona Scoliosis Physical Therapy concept by Rigo aim? But this one, yes, if you want, you have the possibility to get the BSPTS certification for what? To be physiotherapist educated in the treatment of scoliosis and other spinal disorders using the BSPTS concept by Rigo. And this concept based on three important spheres of knowledge. The first one is the scoliosis 3D nature. Here it's very important to understand these three spheres. The first one, to know about the three-dimensional nature. The second one, what is the BSPTS concept? And the third one, the technique. How are you going to use the concept that you have, the knowledge that you have, and also the concept. When we are speaking about the 3D nature, we are speaking about the scoliosis as transversal plant deformity, how growth induced torsion, other mechanisms, and general principle of correction. About the BSPTS concept, it's very important to know the general principles, also the specific principles of correction, and then we are going to learn predefining strategy of correction. At the end, the BSPTS technique is very important. The three-dimensional best possible alignment, the different touching format is not the same if we touch with one hand or with the other, and depend how is our touch, and at the end, the integration of techniques. Okay, if you want to be a physiotherapist certified in BSPTS concept by Rigo, you have the possibility to follow this educational program, this educational plan. In this plan, you have 4 levels. The first one is the base level, and you can do online. This is about the basic knowledge on scoliosis and other alteration of the spine. The second step, level 1, is about the BSPTS concept by Rigo. And here is face-to-face, is presential, because it's very important to understand how to treat, how to touch the patient, because you are going to learn the specific treatment of principles, correction of strategy, and base position, also other things. Next step, and this level, the level 1, level 2, and level 3, there are specific courses that we do in 1 week, in 6 days. The level 2, the BSPTS concept by Rigo, advances exercises and supervision of treatment. And the last one, the last level, the level 3, it's about how to treat the adults post-surgery, teamwork, and orthopedic treatment with corset, with Rigo Xeno brace. Okay, let's go one moment to the BSPTS website to show you how you can find this all of this information. Okay, one moment, I am going to put here. Okay, perfect. Esther, can you confirm me that you have the possibility to see the my screen and the website with your finger? Yes. Can you
Where?
see the website?
No, it went, no. Give me,
Wait. Yes. One moment. What are you watching? Can you tell me?
I'm watching some emails, if I'm not wrong.
Okay. It's here in the, okay. Now, yes?
Not yet.
Oh, shit.
Yeah, you're back.
And now?
You're back.
My back.
Now I can see. You need now to check.
Okay, you can see here the BSPTS-Concept by Rigo.
Yes.
Okay, perfect. Yeah. Perfect. Okay, perfect. If you go here to our website, yes, you can see. Okay, perfect. Thank you very much. Here are the different regions, and see what is one of the most important aim for Dr. Manuel Rigo. When we are working with the patient, we are looking after the person, not just the curve. This is really important for us. Perfect. Here in the top, you have more information about the BSPTS. Here you will find a very nice interview that we did to Dr. Manuel Rigo explaining what is the BSPTS concept. And then here you have the possibility to go and to check the courses. Okay, perfect. Here you will find our base course in 3 languages, in French, in Spanish, and also in English. One moment, we are going to do one try. I need 20 seconds. Because I would like to invite to all of you to see the course and all the information that we have for all of you. Okay. Now, for example, if we buy the course, if we go here, we have the possibility to have the access to the all information. And here you will find 11 units, starting from the welcome, objectives, e-learning process. You are going to have 11 units. The first one about the spine anatomy, about the sagittal deformities, what scoliosis is, about the different scoliosis, infantile, adolescent, and adult scoliosis. Very important to know the process of the natural history of adolescent idiopathic scoliosis, clinical assessment. As you can see here, you have a lot of videos, and in each unit you always will find a self-assessment to know if you have learned and to confirm your learning process. After all of these units, at the end, you will have the knowledge exam. Okay, perfect. Let's go, for example, at this moment to this one, scoliosis definition. If we choose this one, always you are going to find one video under and below you will have the PDF to follow all the information that you have here. Here, in this case, Dr. Manuel Rigo is explaining us.
Welcome to this unit where I'm going to define scoliosis. Scoliosis has been defined by the Scoliosis Research Society as a lateral curvature of the spine.
Perfect. And then after this video, for example, in this unit 3, you will have more videos, and after all of this, you will have always one exam. Yes, the self-assessment. Here you can start. You have 10 questions, and to do this question, you have 10 minutes. Here, for example, you have the first one. Perfect. Then think that maybe you finished the process. Okay. You can see now the slide, Esther. Esther, can you confirm me the slide?
Yeah.
Okay, perfect.
You
Okay.
want for the, yeah.
Okay, perfect. Thank you very much. Here, at this moment, I would like to say and to remark one specific thing. We have at this moment an agreement with the Kenya Scoliosis Foundation. I'm very happy for this agreement with all of you because our idea and our intention is to help to all of you as soon as we can, as much as we can. And the price of this course, the base level, is 210 euros. We know that it's difficult for a lot of people. And with this agreement, for all of you, for the Kenya's physiotherapists, it will be 110 euros. And from the BSPTS, our decision is we will donate to Kenya Scoliosis Foundation 15 euros per registration, not next year, for the following years. Okay, and I would like to say thank you very much, not only to Esther, also to Dr. Nasib, because last year when I was there in Kenya, in Nairobi, I feel the same that I was in my house. From my heart, thank you very much for the all work that you are doing at this moment in Kenya. Okay, perfect. Now, I would like to follow a little bit the educational program that we have. What are you going to do after the base level? But remember, after the base level, you will have the possibility to do and to go to level 1. Here in the level 1 course, you will learn the general principles of the BSPTS concept by Rigo, specific principles of correction. You are going to start learning how to treat the patient. You are going to learn the predefining strategy of correction according to Rigo classification and basic on-loading starting position and integration in loading position. Here you have the 7 units that we are going to learn together during the 6 intensive days. For example, here you have different pictures about the general principles and the step 1, but what is the work that you are going to do? Gradual introduction of the 4 general principles in unloading position. Here you can see the first picture, the semi-hanging position, prone of knee, supine prone on tools, on a stool, sorry, and side lying. Okay, think that maybe you decide to do, you finish the level 1, what to do. But the first one, you are going to have one exam and you need to pass 9 months to go to level 2. And why? Why? Because you need to integrate the concept. Okay, after all this period, the 9 months, you will have the possibility to go to the second level. Here, the most important thing that we are going to do is to see and to revise how you treat the patient. We are going to work with the patient. Yes, how do you touch? If you integrate all the information about the concept and also the reflection about the classification. And again, we are going to revise different specific concepts. For example, the first unit, revision of level 1, revise the BICE concept related to the clinical and radiological assessment and classification of the patient with scoliosis based on the BSPTS concept by Rigo. Then in the second level, we are going to teach the advanced exercises and, as I said before, the practical supervision. Here, for example, you have the muscle cylinder and the Andreas cross, and in this level, we are going to learn more and more exercises. Okay, and then after it, after some, also 9-10 months, you are going to have the possibility to go to the level 3. Here in this last level, we are going to learn about the adult scoliosis, how to treat the surgical, how to treat the patient after the surgery. We are going to start working with the treatment with groups, and also we are going to learn more about the orthopedic treatment. After all of this, we are going to do also an assessment, one exam, the final exam, And if you pass, you will get the certification and end of the formation. And after it, what we can do? Go to the party, all of us together, yes, to celebrate, to pass a very nice days together. And I hope to see all of you soon. From here, from San Sebastian, from Spain, the first thing, regards from Dr. Manuel Rigo. And I would like to invite to all of you to visit our website. Our school is open for all of you. And if some of you have some questions, something, I will be here to answer if I can. And thank you again, Esther. Thank you again, Dr. Nasib. And thank you all friends from Kenya for your attention and for the work that you are doing there. Bye-bye. Thank you very much.
Thank you very much, Dr. Gary. That was beautiful.
Thank you.
Very nice presentation there. You already feel your family in Kenya. Beautiful pictures, beautiful memories from last year. Thank you very much. On behalf of Dr. Nasib, thank you very much. And Nairobi people, it is wonderful. Please, you can type in your questions so that you can ask Dr. Gary questions. As we also invite Dr. Hagit. Hello, Dr. Hagit.
Hi, good evening, Esther and everyone else. Good evening.
Good evening.
How are you doing?
Welcome.
Thank you.
Very well. Welcome back. Very much.
Very good work, Hagit. Congratulations.
To you too. Thank you, everybody. Good to help
Yes.
you guys.
Very well. I see Dr. Maderi. Good evening, Dr. Maderi. Hi. We have one of my co-hosts, Dr. Maderi. Please say hi.
Nice to meet.
Hagit and Dr. Gary.
Regards, how are you?
Dr. Maderi is a colleague, is the head of department at JK Watt. Yeah. So welcome. Maybe we start with a question I'm seeing here for Hagit as we wait for more questions to come in. I have a question from Constantine from Kenya.
Sure.
For you, Hagit. And it reads, can these methods of scoliosis correction work on scoliosis due to neurological disorders, for example, scoliosis due to cerebral palsy, asymmetric or polymetric scoliosis? You got that?
Okay. Yeah. So it's an excellent question. Most of the methods are being examined and researched around idiopathic scoliosis, primarily adolescent idiopathic scoliosis. We use, or many of the methods work and express the methods, their own methods, on other type of scoliosis in a different and a modified way. So you can take principles of every method and apply it on different type of scoliosis according to the person, to the adolescent, to the juvenile, to the young adult capability, mental capability, emotional capability, physical capability. Again, the research is mainly done on idiopathic scoliosis, but in a modified way. If you are an experienced clinician, you can take and modify the exercises for almost every type of scoliosis. The expectation of the treatment, the goals of the treatment, the outcome might be different, but it's better to do something than doing nothing. So I would say learn any method that you're interested, and then use it's a box of tools to allow you to negotiate your treatment with scoliosis, any kind of scoliosis, in a better way.
Beautiful. I believe Konstantin Mokale, you've got that from Dr. Hagit. Thank you so much, Dr. Hagit.
Of course.
And I'm picking questions not in any particular way. This one's for you, Dr. Ari.
Yeah.
Yeah, perhaps you can explain on this point. Someone is asking, how do you get to be enrolled?
Sorry, I don't understand.
How to be enrolled on PSPT school?
Do you understand, Hagit? Enroll?
Is it for me or is it for Gary?
Oh, it's for me, but I don't understand the question, Hagit.
Enrollment. Expound.
Gary?
Yeah.
Enrollment.
Gary?
Yeah. Okay.
You hear me?
Yes, the enrollment starts by taking the basic course online, okay, via the BSPTS.net website. Once you finish the basic course and you get the certificate, then you can
enrollment is when somebody become a student and get.
Sorry, we have another question coming in. Yes, please, Dr. Mwangi.
I was trying to explain to Gary.
Yeah.
Yes.
What the question meant. Enrollment means getting to become a student of this training of PSSE and getting certified. How can the physiotherapist become part of your student group, and then you train them and you certify them? How can they register? That is what they're asking. Enrollment.
Yeah, Dr. Hagit Berlinski was answering this question. The first thing is, at this moment, we have the online course, and you can go to our website, BSPTS.net, and there you are going to find the course, the online course. After this course, when you get the certification, you will have the possibility to start with the level 1. This level 1, at this moment, we are teaching only face-to-face. It's presential. It's not possible to do by Zoom or using other tools, because there we are going to learn the exercises, and this first level to teach, we need 6 days, very intensive days, combining theory and practice. Then you will have the possibility to go to the level 2 and then finish with the level 3. And after the level 3, you will get the certification. You will get the certification that say that you are physiotherapist certified to treat scoliosis patient and other spinal deformity by BSPTS-Concept by Rigo method.
Thank you, Dr. Gary. Thank you very much for that. Dr. Maderi, did you get it right? I hope so.
I hope so, but I don't know whether Gary is promising to come and train for those.
Yes,
because everybody cannot go to Barcelona.
No, okay, Dr. Mwangi, maybe you missed this point. We thank Dr. Gary for the partnership that we made the course of the week. We already have a partnership, so after the basic learning, then Dr. Gary plans some arrangement of maybe coming to Kenya That's right.
Yeah, it's true.
Yes.
Yeah.
That's
Yes,
right.
last year I remember very well. It was a very nice experience with all of you. And if the BSPTS, the school, Dr. Rigo's school has the possibility to help to all of you, it will be really, really, really important for all of us. Yes, we will find if I have the possibility to go, or maybe other teacher from our school. And I'm sure that in the future, we are going to have a BSPTS teacher from Kenya. I'm sure.
All right. That's
It's
beautiful.
it's not a short way. It's a long way. It's very important not only to understand the scoliosis, also Dr. Rigo Hagitz has presented in her presentation, and very clear. Dr. Rigo is a very big professional, but in my opinion, and I'm sure that in Hagitz's opinion, it's bigger and bigger and bigger, very big person. Yes, if you have the possibility to one day to know Dr. Rigo, you will understand what I mean, because for all of us, for all teachers, the feeling that we have is more important how to understand the patient, how to understand the philosophy to treat the patient, more important than the knowledge that you can have about the scoliosis. Because at the end, in my opinion, the scoliosis knowledge you have in the books, you can find, you can do other methods or whatever you want. But in my opinion, the feeling that I have working with Dr. Rigo, it's a very big professional, but it's more bigger as a person. I hope that in the future, maybe you will have the possibility to meet with him and to know how he is.
We can't hear you, Esther.
Esther, your microphone is mute.
You're mute.
Okay. Sorry for that. I want to recognize Andrea Lebo. I can see her all the way from Canada watching us. I see many watching us from Kenya. We have Croatia. Marina, how are you? Beautiful. I'm looking at our time. We don't have much time, but maybe one more question for you, Hagit. I've seen a question here. All right, just a minute, I see. It's a compliment. It's a compliment. Very nice work, research work, Dr. Hagit.
Thank you.
Thank you so much.
Thank you.
We have many compliments. They've learned a lot today about the research-based physiotherapy specific exercise.
Thank you very
nice.
much. Yes, it's actually, it's not it's a collaborative work of all the school leaders, and every school leader is should accept this compliment as helping to create this knowledge. We are working really as a team rather than individuals.
Okay. I'm seeing a civil. What I'm just a minute, I get. Okay. So our final comments, we are finishing at in the next 2 minutes. We'll be finished. we're closing up. So maybe final comments for you, Dr. Hagit. We start with you and then we go to Gary. Very quick, short one, please.
Just really, I would say, always look for the research-based method. Look for, and when, if you're a therapist evaluating, if you are a family member looking for, I would say it's very important to find the evidence-based method and follow that rather than advertisement and promises, and be very aware. This school of the PSSEs, some of them, all of them are really acceptable in our social community. Some have more.
1 minute, 1 minute, Hagit.
Okay,
1 minute to
bye.
finish. I want to
Thank
give to
you.
Gary before we finish, please. Yes, Gary, please.
Congratulations to all of you. I remark the same. It's very important. The evidence is very important. The evidence, but also remember, it's more important. How is your head? How do you feel the concept? How do you treat the patient? And understand that in front of you, you have a person. It's not only an X-ray. We are looking after the person and not after the curve.
Thank you so much. Thank you, Gary. There. Thank you. We have to go. Thank you so much. This session.
Bye bye.
Bye.
Yeah, bye bye. Continue typing in your questions. For those who have questions, they'll be answered on Friday by Dr. Gary. So
yes,
keep texting me your questions. Yeah. Yes.
The other day,
Friday.
Dr. Rigo did a nice presentation about the biopsychosocial approach. This is the most important thing.
Yeah.
Congratulations again. Bye-bye.
Congratulations.
Bye-bye. Thank you so much, Dr. Gary.
Great job. Great job.
Bye-bye. All right. Thank you.
Bye-bye.
Bye-bye, everyone. Bye, Dr. Mwangi.
Bye-bye. Bye-bye, Gary.
Bye-bye. Bye. Bye-bye. We have to go. Thank you.